It is very important that one develops very early on if you want to work in the medical device field or in the health tech field or anything that touches a regulated product environment, that you understand the interactions between different stakeholder groups in order to get to that simplicity. While I want to design everything with patient outcome in mind first, I have to think about who else is effective. If it's a surgical implant that a doctor has to implant, there are two user groups that have to interact with that patient. It's the patient after implant, it's the surgeon or the doctor prior to implant. If it's a wearable, who teaches the patient to wear that, apply it correctly, use it correctly? How do we know that the patient is conforming to the protocol prescribed by the doctor?
Welcome, MedTech Gurus. Today, as I mentioned in the introduction, we have a fantastic guest with us, Marcel Botha, CEO and founder of 10x Beta. He joins us to share his insights at the intersection of innovation, entrepreneurship, and product design. 10x Beta is a Brooklyn-based venture studio that goes beyond investment. Marcel and his team specialize in helping startups conquer some of the most critical and capital-intensive early stages of product development. From industrial design to regulatory strategy, 10x Beta supports innovators with tools to reduce capital burn, compress timelines, and improve their odds of success in regulated markets. Hey, Marcel, are you ready to be our guru today?
I am. Thanks so much for having me, Tom.
Oh, we're excited to have you. So tell us a little something fun or interesting about yourself or your family so we can get to know you a little better.
My family is all about fun. I have 3 kids, 6, 8, and 10, and we are. My house has turned into a giant maker lab. Art, product, invention, Lego. So it's beautiful chaos, 24/7. That's the summary.
I love it. Beautiful chaos. That's a good way to define it. And it sounds like you're grooming them to perhaps follow in your footsteps or do some great design work.
Just to ask great questions,
Yeah.
and to not accept the status quo. If something bothers you, fix it. If something's missing, make it.
Yeah.
It's it's a challenge to try. It's a challenge and the nice reward of having been trained in product development and engineering and commercialization of products for 25 plus years, to then translate those skills to these preteen kids that have the whole world ahead of them. It's like, I think it's the most glorious moment in time right now.
That's fantastic, and I totally agree with that. So it's a fun age, and I think you're going to love that journey. And then speaking of journeys, Marcel, you've had a very diverse journey. As I did my research, you went from architect to engineer to entrepreneur, if I have that right. And I'm just kind of curious, what was the spark that led you to launch 10x Beta? Can you give us some insight there?
Yes, I think the spark was also the impetus, for what I would say is kind of the third act now of 10x Beta. 10x Beta started in 2010. We effectively was just me and a laptop for the first year, doing product management consulting globally: Hong Kong, Sweden, Berlin, New York, South Africa, and really. But the premise was, I just came out of my first 2 startups post MIT, and I wanted to do more products simultaneously, not one at a time. I also wanted to figure out what is the industry that I'm very passionate about. Is it generalist product development? Is it easier things? Is it harder things? There's very few easy things in product development because it always looks easier once it's done. A beautifully designed, simple object was not easy to make, and nor was it easy to conceive or develop to that point. But I wanted to, one of the things that I saw in early stage startup is that a lot of inexperienced founders, inventors, bright-eyed and bushy-tailed students come out and they want to launch a hard product. And, I've had the privilege of working with some really gifted individuals. But the challenge is they go and they spend a lot of investor money on learning how to do product development, learning how to launch a company, versus optimizing for the for the task at hand. How do I spend in a very lean way all my capital on getting the product to market? So that skill set is not something that's required of early stage founders. They'll just figure it out as they go. A lot of waste happens there. And I don't think we scrutinize the waste. So that was an impetus for me to start 10x Beta in 2010 to figure out how can we do many of these at once? How can we share the learnings from past successes and failures? Then how can we optimize both implement those learnings and optimize the process going forward? And then 10x Beta, became what it is today over 3 phases, as I said. There was the pre-pandemic, pandemic, and post-pandemic eras, and we had touched over 200 products. Many of those have launched. We have a disproportionately high launch rate for products relative to the startup market. But that's not hard because if we were as successful as the startup market, we would not have a business.
Right.
But it's so it's been an incredible journey to sort of like optimize and learn over the years how we can basically do the same thing better and better and better while staying contemporary and relevant as technology shifted over the past 20 years.
Yeah, I love that. I love the simplicity and kind of building on some knowledge, right, with some of those early stage. Let's tackle a couple of early and easier things, and then kind of just stack from there, right? Yeah, for sure. And then you described 10x Beta as a venture studio, which I found very intriguing. I'm wondering if you can help us out and explain what that means in practice and how it's different from a traditional accelerator or a VC group. Can you give us some definition there?
Yes. I think I've always wanted to launch something like a venture studio, but I did not have the words to describe it. The impetus for starting 10x Beta was to do more than one thing at a time, to optimize, to share, to learn, especially from past mistakes. So a venture studio platform is not a new idea. Common nomenclature and writing around the theory of venture studios puts us in about the 5th generation of venture studios. However, I think what we are doing that's different than other investor classes is that we are extremely hands-on. We come in we have 4 deal types that we push into the world. We are minority investors where we compete with all the rest of the investors, and those are not the greatest, but they completely stand alone. We meet a lot of great founders. We see a lot of great technologies, and we sometimes take bet on those technologies and help them in some way or form to accelerate their product to market. A more common format is where we take a founding stake in a company alongside an existing team, where we might own as much as a quarter of the company. And we behave like founders. We do everything we roll our sleeves up and we get our hands dirty. And we raise money, we build decks, we build product, we help hire, we socialize that to anybody that would listen. A third format is joint venture with corporations, where especially with the shifting economy, shifting innovation landscape, you see a lot more R&D being purchased, not internally innovated. With cost reductions and massive corporate overheads, it's cheaper to hire a team to develop a product than it is to internally incubate it. Not in all cases, but most of the time. So that's a deal format that we bring into the venture studio, and then there's incubation where we see white space in the market. Typically, that's adjacent to a specific government or corporate expression of need, and we look for non-dilutive funding opportunities to kick off the research phase to initiate that new venture. So we have about 2 or 3 of those right now in the portfolio. But the venture studio is a place where we are actively building companies to sell, whether we sell them pre-revenue, post-FDA clearance, or in a like a scalable revenue-driven state. The goal is to build a sellable enterprise or a sellable product line that can be added to the cash flow pipeline or the sales pipeline of an existing corporation. The goal is not, in many cases, for us as a health tech focused company, not to build 100 standalone companies that are living in isolation of the world, but rather to build 100 companies over the next 10 years that will lean into the thesis, our thesis, but also the world, changing view on healthcare. Healthcare is shifting from reactive to proactive. It's shifting from the hospital to the home. It will not move through that sequence or that change in a single step function. It will be many iterations over the next 25 years of technology, of infrastructure, of underlying device, whether it's diagnostic, therapeutic, or wearable, or monitoring device, to get to that end state. So it's always in motion. So we want to be part of that conversation, and in order to be part of that conversation, we need to be in the mix, not just investing into it. So we're not the big capital that comes into the company at late stage seed or Series A. We are the first capital, and we take the highest risk, but we also have the skill set to de-risk a product the most.
Yeah, that's interesting, and thank you for that explanation. It was really helpful. And I'm wondering, as you explain that, does that take a certain type of founder to kind of match up with you with that mindset of, hey, we're going to find maybe partnerships or collaborations along the way versus, hey, this is my baby and I want to see it to the end?
Yes, it's we're learning. I think we are all learning because it requires a very strong ego to come out in the world. Say, I'm going to build this. I'm going to make it. I'm going to make it successful against all odds. When we are seeing different leaders for different types of companies. When you are doing a joint venture with a corporation, you ideally want a special forces team just executing at high speed so that it's a B2B transaction. It's not a singular thought leader. When you are a startup that's fundraising, you need that CEO candidate to be a very strong, thoughtful, forward-looking individual that the investors trust to lead a team to success. When we do a minority investment where we're also helping with the product execution, we only do those if the team is already in place, which is different from when we invest in an early stage team that's not fully baked yet. And then when you work with the government, it's a different group. It's typically these are research like paid R&D or R&D. Deeper research funded. There's been a lot of flux in government funding recently, but we've been able to, show up and be counted across our work with both public and military health, and figure out how we can contribute in those areas. And I think that we all just hopefully we keep delivering as we are held to a higher standard.
Yeah, that's helpful. And I want to take you back to something you said earlier. We were talking about simplicity of design. And, I see in my careers, startups often get stuck in that first mile of product development. And I'm wondering if you can build on that a little bit in terms of what are you seeing in some of the bigger bottlenecks and how does your team help overcome them? Can you provide us some insight there?
Yes, I think the product development process, especially for medical products, is an extremely it's an already very well established process. So for somebody to come in from outside to disrupt it and wanting to focus only on the design or only on the what this product does better, why is this the better mousetrap, fails to understand that in healthcare, it's a multi-stakeholder audience. Everything needs to be in service of the patient. How do I make the patient outcome better? Because if I'm not making the patient outcome better, why am I doing it? If I am able to make the patient outcome better, then the economics come to play, and then the regulatory comes to play, and then the scaling partners come to play. It's very hard to distribute a single product company globally.
Mm-hmm.
Much easier if that single product company gets rolled up into an existing sales organization that is not innovating as effectively as you. Regulatory, it's great if we can get regulatory approval and clearance. That doesn't mean that you have reimbursement approval. This is for probably the first 10 years of my career touching medical devices, we myopically focused on getting regulatory approval and became very good at that. But no one was putting nearly the same amount of effort, at least in the early stage startup scene, in there on the reimbursement side. Like, how are we getting paid? If you can't sell your product to, well, let me rephrase that. If you can't get paid, if you can't build a sustainable financial business, you can't build more beautiful, simple products.
Mm-hmm.
And this is what Apple does so well. Apple is a consumer business, but they build upon past success by managing all these stakeholders.
Mm-hmm.
In the case of healthcare, it's harder. So large organizations that have you serve the care provider, the patient, the health system, the insurance organization, and then all the regulatory bodies. It is very important that one develops very early on if you want to work in the medical device field or in the health tech field or anything that touches a regulated product environment, that you understand the interactions between different stakeholder groups
Mm-hmm.
in order to get to that simplicity. So while I want to design everything with patient outcome in mind first, I have to think about who else is effective. If it's an implant for if it's a surgical implant that a doctor has to implant, there are two user groups that have to interact with that patient. It's the patient after implant, it's the surgeon or the doctor prior to implant. If it's a wearable, who teaches the patient to wear that, apply it correctly, use it correctly? Who observes the patient for, if we're thinking about adherence models and drug delivery and other therapies that are taken at home, how do we know that the patient is conforming to the protocol prescribed by the doctor?
Mm-hmm.
So it's a much more complex yet rich experience. And once you get into the weeds, and the beauty of the venture studio is that because we are not just focused as in a design, we're not just a design studio, we're vertically integrated. We have everything from napkin sketch to launch under one roof. And we've been speaking a lot about the benefit of this, in light of tariffs and domestic manufacturing and supply chain risk. We're able to go from napkin sketch to launch in one facility, 12,000 square foot, so tiny at the scale, relative to the scale of a large multinational medical device distributor like Boston Scientific. However, we can be agile, extremely agile during the innovation process, where real-time product and patient feedback can be matched with real-time business model and reimbursement feedback and real-time regulatory feedback.
Mm-hmm.
So we don't have a lot of stage gates that prevent us from doing those three things simultaneously. And that design process is much richer because it encompasses all those stakeholder challenges that might present itself if you were instead doing it in series.
Gotcha. Yeah, and that's a fantastic explanation, and thanks for that. And you touched on something that I want to dive a little deeper in, right? Because you mentioned the FDA and the regulatory compliance, and your team's known for helping companies align product design with that regulatory compliance, in early stages, you mentioned. So let's go a little deeper. How do you integrate that FDA pathway planning into the design process without stifling innovation? Can you provide us some thoughts there?
Well, again, I mean, as I mentioned, I think we have we have to think about the stakeholder map, who's going to be involved, how we get paid for the product, and how we get the product approved. And you can't do any of those in isolation. So you don't have to stifle the innovation process just because you have to conform to regulatory rules. I think understanding is key. So what we deal with that in a multitude of ways. We have specialist consultants that consult from outside that are domain specific. In-house, we have generalist consultants and quality managers that manage that process internally so that it's not an afterthought. And then we have a team that have become, over the last 20 years, more and more experienced. So 10x Beta is not 20 years old, but the team have been working together and have known each other, some team members for 10, 15, 20 years. So the sophistication also comes from the trust that we have established over many years and many products that we have launched together. And that was part of the original thesis for 10x Beta. How do we invest in that muscle memory as a group? And post-pandemic, in our third act, as we launched the Venture Studio, we realized that muscle memory for innovation and regulated innovation as an underpinning of a venture studio is an extremely valuable asset, because most other groups that start venture studios build them from scratch, and they pay a lot of money to build a cohesive shared services team that support their portfolio companies.
Yeah, got it. Thank you. And then, looking at what your portfolio is and some of the items that you've mentioned, right? It looks like you've worked with both hardware heavy and then software driven startups, both. And I'm just kind of wondering how you evaluate which ideas are worth building, and how do you prioritize speed versus quality? Can you walk us through that process?
Yeah, so I think it's probably the hardest thing that we get to do, right? So we don't have capacity to do unlimited amount of products or launch an unlimited amount of companies every year. So our thesis is, aligned with what I mentioned earlier. Healthcare is moving from the hospital to the home. It's going to be multi-generational. It's going to address everything from infant care to female health to aging in place. How do we lean in and develop solutions, connected health solutions for that future healthcare state? So everything goes through that filter. Is it hardware? So it always has a hardware component, even if it's software heavy. Is it smart? Does it have data? And can we build intelligence systems on top of it? There's a lot of hype around AI companies, and I think we're just starting the second hype curve on that. The challenge is that AI, to the layperson, seems like magic, like this cloud computing intelligence. The reality is that in a connected world, the entire stack that supports that beautiful last step that we interact with is hardware enabled. The energy system, the cloud computing system, it's a data center or like, the communication devices that connect us to that cloud infrastructure, the sensors on the products that derive these small data sets. MIT recently referred to the data in healthcare that we are interested in as not large data, but small data, verified discrete data sets that are hyper-specific to the application. This future won't be enabled with hardware that is software-enabled with data streams and connectivity as a standard operating protocol for all future medical devices. And I say medical devices not flippantly, because wearables and consumer wearables are already trying to do this, but they don't do it at a medical grade level. And if they are doing it at a medical grade level, they're doing it in the most simple, most sometimes inane way that's not really adding value to the user's deep medical needs. So I feel that it's our duty to get medical grade technologies miniaturized and into the home to a point where the built environment, the way where you live, is as a seamless integration of also supporting your future health outcomes.
Yeah, I'm kind of curious about that data piece, right? Because we've had a number of gurus on the show talking about artificial intelligence and AI and the data, and you were talking about a highly focused data set. It would seem to me that that's a big part of the lift, right? Finding that data set and refining that data set so it's meaningful and consistent across the scope. Am I heading down the right direction with that?
Yes, no, truly. I think that you have to uh, you have to assume that you're not going to buy data from others.
Mm-hmm.
You will be the enabler of data collection when you are at the device layer.
Mm-hmm.
And the device layer, a lot of early stage medical companies that I've been involved in the past and that I've seen over the last 15, 20 years, when they were hardware focused, even software enabled hardware products, they focused so squarely just on the hardware.
Mm-hmm.
But the future of hardware is that it's commoditized, enabling data services, enabling intelligent systems to be built on top. So can we, that's a challenge of ego, because I want my physical thing, my simple, beautiful product to be front and center. But the reality is it should barely feature if it's successful in a
Mm-hmm.
future healthcare state. And it should just be a seamless experience that we don't think about it because it just makes our life better without us having to acknowledge it or pay homage to it every day.
Yeah. Yeah. Well, that's really helpful. And you touched on the pandemic, Marcel, and I'm kind of curious because it was indicated to me, your team worked on some open source ventilator projects. And I'm wondering, what did that experience teach you and your team about that urgency, collaboration, and design under pressure that you were able to carry forward?
Yes, that was quite an experience. It's well documented. About 5 years ago, we were asked to lead the ventilator response for New York City.
Mm-hmm.
We evaluated two projects that were going on that started about 10 days prior to us. One at MIT and one at other labs in San Francisco. We got on a call with all three, decided that we were going to partner with MIT and their open source ventilator and figure out if we can do a derivative product of that open source product for New York.
Mm-hmm.
We arrived on day 10 of their research work. Now, day 10, it seemed like not a long time, but our participation in the product was only 30 days from start to successfully delivering the
Wow.
first major shipment of ventilators to New York City. We then delivered 3,000 with the capacity to build another 11,000. But that was everything. What we learned from that process was that you can't skip steps, and it's a famous. It's become sort of like synonymous with our process even today. Even though the timeline was compressed, we still had to design the best product with doctor involvement and clinician involvement and anesthesiologist and pulmonologist involvement to serve patients that were under duress in a moment in time when we did not fully understand what COVID's impact on the body was just yet.
Mm-hmm.
So the assumption was that we needed a lot more force and pressure to keep the lungs open once on the ventilator. The reality was that where these machines were designed, once we started treating COVID at scale, they were probably over-designed for what they needed to be, but we had no, there wasn't another cycle to go back and during that 30-day process to completely re-envision it. We did do 4 versions, which means that we did version 1, 2, 3, and 4. 4 is the one that shipped to New York City with significant upgrades at every step. We did about 3 years of work in that 30 days with a team of 120 people that barely slept for 30 days. That means that you're dealing with all with, not skipping steps, regulatory, financial, legal, human emotions, everything, all in the 30 days compressed. So it was immensely tense, but America is the only place I feel like where you can do this and run at that speed and be celebrated, because we were, shallow husks of our former self by the time we finished and needed some months to recover. But we did it with this uh, effort that was spearheaded by a want to be in service of the moment, isolating ourselves from the detractors. One of my clients said to me that there's no way we're going to be able to do a ventilator in a meaningful way. We should just stop now. And I just smiled and I said, "What can you do? I can't get into an argument because at that moment in time I had not built the ventilator yet." But it was good fuel to get it done. And there was no moment during that process for ego saying, "I'm going to show the world." It was just so brute force that we just had to get it done. And then what we did to protect ourselves and, effectively the patient at the end was we would create teams that would offset against one another and test each other's work constantly and ask the questions, what's the risk? So no steps were skipped. They were just done in the most efficient, yet brute force way that I've ever seen something done. What we do today is not as wasteful, because you waste a lot of money when you go at that speed. But it does follow the same process and the same questions around how can we remain in service of the end objective, and it's allowed us to do more and more interesting work for both for customers and joint venture partners, as well as startups that we believe will have a greater impact going forward. So it's helping with the filtering of who we work with, what we work on.
Yeah, that's really interesting, and I'm glad you mentioned that process and the questions and the double check, because I'm thinking it really probably it helped you with a lot of communication norms and documentation strategies as you went through that process. Is that what you found?
I would say that all the communication had to happen in real time. I think we only use Slack, and email was like I would say it was in person, Slack, and email. No other tools. Documentation and regulatory paperwork was entered digitally, but the output was paper based still. It was not an all digital system, which means with every version that we sent to the FDA, we submitted another, what was it, 200, 300-page report. All the testing and all the validation and all the volume, the lung function studies that we did, we had a separate team, at arm's length of the development team performing that testing, so that we can't, take shortcuts. Yeah. But it was, so again, it was extremely cumbersome documentation and communication process, but it happened at a speed that I've never seen.
Yeah.
And it required, my partner on the project, Scott Cohen, was, I would call him our Sherpa. He was making sure that emotionally we were all level set every day and not losing the plot. Yeah. Because I am completely on the other end of the spectrum. I am the brute force guy that will break through walls. That's part of my South African nature. We're going to get it done. Yeah. No questions.
Right. Yeah, I love that, and thank you for that. And I'm now thinking, you've sat at the table, right, with inventors and investors. I'm wondering if you could share with our gurus out there, maybe one piece of advice that you would give to an early stage medtech entrepreneur trying to raise capital and build a product or company simultaneously.
Yeah, I think there's a couple of industry learnings which others would also echo. Don't do it yourself. Build a team of at least 3 people. Make sure that your founder level relationships are solid and documented, because you're going to disagree and you're going to become agitated, and you need to always level set around what is the mission and what are our obligations to one another. Most companies fail because of founder disputes, because they don't do these steps properly in the beginning.
Mm-hmm.
And the better friends you are, the more you need it for the obligations that you have to each other. Then, second, stay on mission. It's very easy to get distracted. However, make sure you have product market fit. Don't be secret about it.
Mm-hmm.
Tell 100 people about your idea. Get 100 people's input. I see a lot of people who are arrogant. A lot of young people are arrogant about how awesome their product is, but they've not spoken to enough people. It's like living in a vacuum chamber is the biggest risk for a young founder, because they clearly have invented something that the world has not thought about. But the reality is that ideas are cheap. Ideas are it's the implementation that matters. No one you cannot buy dinner with your 3D printed product. The 3D printed product needs to become a real injection molded product that's distributed, used on patients, has hope. Well, by the time it's on patients, it should have regulatory approval, and it should have a reimbursement code. So the idea doesn't mean much. Don't be so precious about it. It is very important to focus on how am I going to navigate all the learning I'm yet to do as an early stage founder, relative to the confidence that I need to inspire in my investors, that I am a competent human and a smart human, and with resilience that's going to get it done, because I'm going to 90% or 99% of what I think of today as the plan is not the plan. It's going to be rewritten as I learn more. And I think, it's very important to level set every day and how you show up to get your product to market. Because if it's ego driven, it's going to fail.
I love that, and I'm smiling here because what's echoing in my mind is that your earlier statement of don't skip steps, right? So
Yes.
Yeah, outstanding.
Yeah, it's very easy to do all the sexy things. Make a render, make a 3D print, test it on your cousin who's not a patient. Get photos, make everyone excited about it. Build a deck that doesn't really understand reimbursement or the true cost of manufacturing or supply chain risk. But you have to, I think, understanding. For me, what has served me well is I have a big, and I read a lot of news, so I have a big general understanding of geopolitics relative to my industry and relative to also the product industry as a whole. And I think that has just served me well as a human, but also as an innovator, to understand how my products will fit into the world, where the opportunities are, where the risks are, that are existential to just the innovation at hand.
Yeah, that's really good advice. So, Marcel, this really sounds like a very exciting time for you and your team at 10x Beta. What does the future hold? Where are you going from here?
Yeah, so we have about 17 companies in the portfolio. We're onboarding 4 of them now, but we have a very exciting. We're 2 years behind us. We're starting to see sort of major shift in the cohesion of the model that we have built. But I think we're at a moment where we're level setting and understanding that it takes 5 to 6 years to build this flywheel effect of starting companies, building them, launching them, and selling them, for this venture studio to really make its mark, not just in New York City, but here on the East Coast and the US as a model. Our model is a boutique model. It doesn't. We don't want to be 500 people under one roof. It is. We're finding what that sweet spot is in terms of size. It probably is about 60 people. We're at about 41 now. And then we're also finding out, based on looking at data and experience the last 2 years, what the next 8 to 10 years of company types will be that we lean in more, and what the founder relationships will be that we invest in more. Because ultimately, we want to figure out what is our best way to contribute to the industry with the least amount of interpersonal tensions when it comes to innovating. So that where we shift from historically as an agency, a client vendor relationship, to a partner relationship or to an owner relationship with things that we shepherd through this funnel.
Yeah, that's fantastic. It sounds like a very exciting time. So, Marcel, I first of all like to thank you and acknowledge you for all the terrific insights that you brought to us today as our guru. If somebody wants to learn more about you or 10x Beta, how do we do that? Is there a website? Are you on LinkedIn? How do we learn more?
Oh yeah, I am. I'm not very active on social media anymore. However, I am on LinkedIn. That's the only one. And my email is very simple. It's marcel.botha@10xbeta.com. And my website is 10xbeta.com. That's 10xbeta.com. So those are the three ways.
Yeah, fantastic. So, Marcel, once again, thank you so much. It was a great conversation, and I learned a lot.
Tom, thanks for your time. Well, wonderful to be here.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com. And I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.